Conjunctivitis, often referred to as pink eye, is an inflammation of the conjunctiva, a thin, transparent layer of tissue that covers the white part of the eye and lines the inside of the eyelid. It is a common eye condition that can affect people of all ages. Conjunctivitis can be caused by various factors, including viruses, bacteria, allergies, and irritants. The methods of transmission and prevention depend on the specific type of conjunctivitis. In this video, we will explore the causes, symptoms, and treatments for conjunctivitis, with a primary focus on how it spreads and the best ways to prevent it. So don't skip the video and watch until end. Types of conjunctivitis. There are several types of conjunctivitis, each with its unique causes and characteristics. Understanding the different types is essential for effective prevention and management. 1. Viral conjunctivitis. Causes. Viral conjunctivitis is typically caused by viruses, such as adenoviruses. It often accompanies viral respiratory infections like the common cold or flu. Symptoms. Symptoms include redness, watery discharge, itching, and often a gritty feeling in the eye. It can affect one or both eyes. 2. Bacterial conjunctivitis. Causes. Bacterial conjunctivitis is caused by bacteria, most commonly Staphylococcus or Streptococcus species. Symptoms. Symptoms include redness, a sticky yellow or green discharge, and crusting of the eyelids, particularly upon waking. 3. Allergic conjunctivitis. Causes. Allergic conjunctivitis results from exposure to allergens like pollen, dust, pet dander, or certain chemicals. Symptoms. Symptoms include redness, itching, tearing, and swelling of the eyelids. It is not contagious. How does conjunctivitis spread? Understanding how conjunctivitis spreads is crucial for taking preventive measures to reduce its transmission. The methods of transmission vary depending on the type of conjunctivitis. 1. Viral conjunctivitis transmission. Direct contact. The primary mode of transmission is through direct contact with an infected person's eye discharge or respiratory secretions. This can occur through handshakes, sharing personal items like towels, or touching contaminated surfaces and then touching the eyes. Airborne transmission. In some cases, viral conjunctivitis can be transmitted through respiratory droplets when an infected person coughs or sneezes. 2. Bacterial conjunctivitis transmission. Direct contact. Similar to viral conjunctivitis, bacterial conjunctivitis spreads through direct contact with eye discharge or by touching contaminated surfaces. Autoinfection. It can also be spread from one eye to the other if proper hygiene is not maintained, such as when touching one eye and then the other. 3. Allergic conjunctivitis transmission. Allergic conjunctivitis is not contagious and does not spread from person to person. It occurs as a result of an individual's exposure to allergens that trigger an allergic reaction. IV. Preventing conjunctivitis. Preventing conjunctivitis involves taking proactive steps to reduce the risk of infection and minimize exposure to irritants or allergens. Here are effective preventive measures for different types of conjunctivitis. 1. Preventing viral conjunctivitis. Hand hygiene. Wash your hands frequently with soap and water for at least 20 seconds, especially after coming into contact with an infected person or surfaces they have touched. Avoid eye touching. Refrain from touching your eyes, nose, or mouth with unwashed hands. Avoid close contact. Try to avoid close contact with individuals who have viral conjunctivitis, and avoid sharing personal items with them. Disinfect surfaces. Regularly clean and disinfect frequently touched surfaces to reduce the risk of contamination. 2. Preventing bacterial conjunctivitis. Hand hygiene. Proper hand washing is essential to prevent the spread of bacterial conjunctivitis. Avoid eye rubbing. Refrain from rubbing your eyes, as this can introduce bacteria from your hands into the eye. No sharing. Do not share towels, pillows, or eye makeup with others. Proper disposal. If you have bacterial conjunctivitis, use a clean tissue or cloth to wipe away discharge and dispose of it properly. 3. Preventing allergic conjunctivitis. Identify allergens. Determine the allergens that trigger your symptoms and take steps to avoid them. Use allergy medications. Antihistamine eye drops or oral antihistamines, as recommended by a healthcare provider, can help manage allergic conjunctivitis symptoms. General eye health tips. Regular eye exams. Schedule regular eye exams with an optometrist or ophthalmologist to monitor your eye health. Protective eyewear. Use protective eyewear when engaging in activities that could lead to eye injuries, such as sports or construction work. Proper contact lens care. If you wear contact lenses, follow proper hygiene and care instructions to prevent eye infections. Medical treatment for conjunctivitis. 1. Viral conjunctivitis. Symptomatic relief measures include applying cold compresses to the eyes to soothe discomfort and reduce swelling. Using artificial tears or lubricating eye drops to relieve dryness and irritation. Over-the-counter, OTC, antihistamines or decongestants may help alleviate some symptoms. Avoiding contact lens use until the infection has resolved. 2. Bacterial conjunctivitis. Bacterial conjunctivitis is caused by bacteria, such as Staphylococcus or Streptococcus species. Treatment typically involves antibiotic eye drops or ointments to target the bacterial infection. It is essential to use the prescribed antibiotics as directed by your healthcare provider and to complete the full course of treatment to prevent the development of antibiotic resistance. Symptoms usually improve within a few days of starting antibiotics. 3. Allergic conjunctivitis. Allergic conjunctivitis is triggered by allergens like pollen, dust, or pet dander. Treatment primarily focuses on symptom management and reducing exposure to allergens. Symptomatic relief measures include using antihistamine eye drops to reduce itching and redness, using mast cell stabilizers to prevent the release of histamines in the eyes. Oral antihistamines may be recommended by a healthcare provider for more severe allergic reactions. If you like my video, then subscribe to my channel. Thanks for watching my video.